Hello, my name's Lynn Woolley and I'm the head of Midwifery at Western Sussex Hospitals that serve Chichester and Worthing maternity units. Wanted to catch up with you all following the situation where we've had to suspend our home births, just to give you some information. I'm also just going to give you a bit of information about visiting and also about how our teams can support you and you can support our teams. So first of all, just talk about home birth. Across the whole of Sussex, a major incident has been declared because of the rapid acceleration of the amount of COVID cases. Those are not necessarily concentrated in maternity, but out in our wider community and also in our non-pregnant population within our hospitals. This major incident gives us an opportunity to work as health and care services, as well as some of the emergency responders, to try and do our best to prioritise care. And one of the things that this has highlighted is that our ambulance services are under enormous pressure, and currently the response times are such that while they are prioritising pregnancy and non-pregnancy emergencies, the response times for other emergencies have increased really significantly to the point where it is no longer safe for us to support women with home birth, because in the event that there is a complication, we would have a long delay potentially in getting you to hospital, and the impact of that could be very significant. It could be that there would be short-term or long-term harm to mothers and babies, and there is always the very small risk of death arising from that. So we have had to make the really difficult decision to ask all mothers who are planning home births to come to hospital to have their babies. Now, I do want to reassure you that the ethos of home birth will still be there. So for those women who are planning a home birth, when they and their partner come in, you will be given a very warm welcome. We are going to ask our community midwives to support you with your home birth so that the same ethos is there. And also we'll try to get you home as quickly as we possibly can so that you can go back home and do your nesting and start your parenthood journey. We would never have wanted this for you, and we are so sorry that we find ourselves in this situation, but we have to do the safe thing. If you have any concerns, if you contact your community midwife, and we can give you more information on that. In terms of visiting to our services on both sites, we're going to continue with the current visiting, which is for partners only. They are welcome on Tangmere Ward at Chichester and Bramber Ward at Worthing from 2 until 5. We would ask that you pay particular attention to the infection control measures, so please do wear a mask, regularly gel your hands, and if you can avoid going in and out of the service, that would be fantastic. So when you come in for your visit, if you can just come in and stay. So you might want to bring some snacks and things with you, and we can give you tea and coffee. In terms of our clinics, at the moment we are continuing as we were before, so partners are very welcome to any early pregnancy scans, to the 12-week scan, to the 20-week scan. And in cases where we're monitoring if there's a concern potentially about the baby, they are also welcome to the fetal medicine clinic scans, and also where we consider that there might be a problem. We can't currently welcome partners to growth scans when these are just routine growth scans, and that is because the footprint of our clinics is very small, and there is the potential risk of cross-contamination. So we hope that you'll be understanding on this, and that having the opportunity to attend those other scans will make up for that. We would also ask that you don't bring children to the clinic. We're extremely proud of our maternity team here at Western Sussex, and they have worked so hard and have spent the last 10 months often 12 hours a day wearing masks and protective equipment, and only able to remove their masks for a couple of minutes at a time to eat and drink. So we're very grateful to them for how hard they have worked, and we're very grateful also to those of you who have just treated them with such respect and kindness. We have been experiencing, however, on a daily basis, some verbal aggression and abuse towards our staff. And while we totally understand the frustrations that you feel, we would ask that you just continue to be patient and continue to support our staff in the work that they're doing. So we're keeping everything under review, and in terms of the home birth service, we're meeting 3 times a week with the ambulance service just to hear about how the response times are going. We anticipate that we probably will be in this wave and in this position probably for the next 3 weeks. So until towards the end of January, but as soon as we possibly can, we will start to get back to normal with all of our services. We feel very optimistic about the vaccination programme and the impact that that is going to have. And in due course, as soon as we hear more about the plan for vaccination of pregnant and breastfeeding women, then we will make sure that we communicate that to you really clearly. So in the meantime, we are here. You will always be welcome in our service. Please do contact us if you have any concerns. The numbers are on the front of your notes. If you're not sure of anything, then get in touch, and we'll look forward to seeing all of you in due course. Thank you.